Hi, my name is Jem. I'm one of the CRNAs of IAA, originally born in the Philippines and then moved to Connecticut and now currently live in West Hartford and have been here since I was 8 years old.
What is your role at IAA?
I have worked for 6 years as a nurse, have always done cardiothoracic surgery, and my mom was the one that kept on pushing me. I had no idea what a nurse anesthetist was. And then eventually when I ended up on Bliss 9I, I was working a lot with the fresh post-cardiothoracic surgery patients, and like Dr. Check and Dr. Aldo, Dr. Blinder, they would drop all these patients and they would have 12 drips on, and somehow they kept the patient alive in the OR and managed all that. And so that kind of started sparking my interest, like, wow, I want to figure out how to do that, but downstairs in the OR, and somehow know how to balance all that and, work with the surgeons downstairs and be able to bring the patient up to the ICU stable and post open heart surgery, whether it was a heart transplant or a bypass. So that kind of pushed me to figure out what a nurse anesthetist was, and here I am.
What led you to join IAA?
When I decided that I wanted to become a nurse anesthetist, it just so happened that year that IAA became a part of the nurse anesthesia program, and it was here at Hartford Hospital. So my teachers are the staff of IAA, the nurse anesthetist, the anesthesiologist, and at the end of my journey, it just felt right to stay with IAA and become a part of them, and also be one of the teachers now for the future nurse anesthetists. We also work a lot with the residents.
What leadership opportunities are available at IAA?
They actually do offer a lot of leadership roles. There's many of us who are clinical leaders in different subspecialties. We're there, for any of the new hires, just to make them feel comfortable and help them with the layout of the land, how things work. In terms of being a teacher, it's very much a teaching hospital, so we work a lot with the student nurse anesthetists and the residents. So it's nice because it keeps it fresh for us too. Like we're constantly learning as much as they're learning. And I do love working with them because I do learn a lot from them too, because I think with anesthesia, you're kind of independent. You work with, your attending, and you're stuck in the room, and you don't really know how someone else can, the different recipes of anesthesia. So when you work with the residents and the SRNAs, they actually do teach us too, like, hey, I learned this yesterday from so-and-so, and I'm like, oh, let me try that. That seems like a great recipe, so.
What are the educational opportunities at IAA?
I think it's definitely an academic institution. From my understanding, they're very much involved with the UConn residency. And again, IAA also has the nurse anesthesia program for our nurse anesthetists. So we're very much, I think as a team, we're very much involved in the future and the education of our cohorts.
Can you describe the clinical environment?
For me personally, I'm very much all about team effort. I'm one of the OB team members, and up there we definitely feel like a family. Everyone, like the attending, the nurse anesthetist, the SRNAs, the resident, we're always communicating when we're on that day, and we kind of just split everything. It could be a very crazy day where you're having C-sections after epidurals after C-sections, and we just basically tag team. Yesterday, I had a case where we just couldn't figure out, there was something off with our patient, and so it was nice to have Dr. Hackman, and who we contacted Dr. Aldo to be like, hey, this is what we're trying to figure out. Let's brainstorm together and the three of us together, I mean, the patient did well at the end. So and the thing about IAA too is we work, or being here at Hartford Hospital, IAA being a part of Hartford Hospital in a sense, we do work with all the surgeries and GIs and OBs and radiology. So it's nice to be able to come together as a team and also be a part of the team with those specific subspecialties.
Is your schedule flexible?
You could work any shift that you want that works best with your family. I know some people work 12s or 24s or 16s, or some may come at 10:30 or 11 o'clock, depending on if they have to drop, the kids off at work prior. And also, there's also, now the IAA has many offsites. I think they take that in consideration too if, say, New Britain or the Hamden facility is closer to your home, that you would be assigned to those offsites.
How do you manage work-life balance?
It's harder to manage. I feel like, especially the past year with coronavirus, I think most of us have been working more hours, or the stress level has increased. I think how it affects us mentally, wearing the N95 plus a mask plus a face shield plus a gown or whatnot. I mean, it does take a toll on all of us, and I think more and more now, say in 2021, I think everyone's kind of focusing on really trying to find a sense of balance, and like self-care and spending more time with your family, even though, yes, the past year you've been spending a lot of time with your family at home. But I think it's more like self-care and trying to get used to the new normal out there while wearing your mask in a safe manner.
Right.
I don't know. I don't have a specific answer because I'm trying to still figure it out myself.
What do you like most about working for IAA?
I'm thankful for IAA for giving me the chance to become a nurse anesthetist, because I went through my schooling, with the nurse anesthesia program that they're affiliated with, and also just to be able to expand my skills. I've learned so much from all my teachers here. I've learned so much just from working here and working with the students and the residents. So I'm grateful for that in regards to helping me become a better nurse anesthetist.